when you first contacted me, that was last year, and you were probably searching for like lateral pelvic tilt or pelvic twisting of some type.
I was I was just in pain, and I had I'm trying to think of where I was when I met you. Um, I had I had sciatica that was intermittent. I had been doing your entry level exercises for about 10 months, and
Oh,
they had
that's right, right. Oh, yeah,
they
yeah,
had
yeah, yeah, yeah. I remember. Yeah.
they had dealt with the sciatica pretty well. And I just had felt my body shifting. I was in a job where I was walking a lot. I could tell that PRI was doing something. And I consulted you after you put up a video about ankle sprains. That's what it was. And putting a shim under your uh, in your shoe at your back heel, and it changed the way that I felt. So like I need to do this, and my pain was I was still kind of in it pretty thick, but I had begun to be able to manage it through PRI, and I just that was when we met. So that's kind of where I was.
Was it? But you were experiencing more than just sciatica, right?
Yeah, so I had lost a lot of hip mobility, right hip mobility, external rotation. I couldn't sit in a butterfly position and drop my right knee to the ground. It
Mm.
was impossible. Right low back was really tight. Um, and I had, I guess, middle trap rhomboid, in between the scapula and the
Mm.
spine. I had tension and pain there all the time.
Mm.
Um, and the entry level exercises had dealt with that with the hip pain. Actually, I was really impressed. Squatting got a lot easier. Like there were just really big improvements with just the breathing and the positional stuff alone for the hip. But I couldn't get rid of I couldn't get rid of the shoulder stuff. Um, and now that I'm farther along, I was ridiculously fatigued,
Mhm.
and like
You don't even know it
I didn't know it.
because
Like
that's your new norm. That's
yeah,
what's become normal too. Yeah.
I had lived in a fog basically for probably since I was 12 or 13,
Hmm.
and that was that was my normal. But I didn't really know that I was in a fog.
Yeah,
So
no, yeah, you don't know. And that's one of the fascinating things. Like, I can't explain to someone what grounding means until they feel it.
mhm. Yeah,
Grounding
yeah,
to me would have been the most abstract term in the world until I felt the floor underneath me in a different way after I got out of my torsion and after I had a flashback to the orthodontist chair when about probably 4 or 5 years ago, and I had like a post-traumatic reliving of that experience that I had no recollection of. And once it was over, I could breathe out of my right nostril, and started walking around, and I felt the ground underneath my feet differently.
yep, yep,
And that's when, for me, that connection between what's going on up here in the cranium and and your connection to the ground are intimately linked. And if up here and down there are not communicating effectively through this rib cage and pelvis,
yep,
everything gets messed up.
yeah,
The rib cage and pelvis are easy to deal with. The problem becomes when the cranium is not connected to the ground
yeah,
because things have gotten too tight up here for some reason. And so that grounding experience becomes very real once you start to feel things differently, because I relived an experience that I had absolutely no recollection of, a trauma that somehow got caught in my cranium. I don't know. There's
mhm,
no other way to explain it. But and that's what we're getting to, is that I think just by reading your questionnaire and then seeing your pictures, I'm pretty sure I alerted you early on that this might be a little bit more complicated. And I think even in the first session, I think I started talking about this torsion situation. There's no way for me to know for sure whether Matt was a torsion or not, because it's only testing that will allow you to determine that. And I don't know how he tested with the other therapists. However, you can assume that it was a cranial issue because of how he got that integrated dentistry. And it was treating this oral cavity, but by treating the oral cavity, he was really treating, I suspect, his brain's sense of pressure in the palate, and it was helping him regulate pressure inside his own cranium so that he could then regulate his body because tension finally started to decrease. So what you're going to see is a picture of my old head from 4 years ago and my head from a couple days ago, and you'll notice that there's a difference. My old head is a typical torsion pattern and neck. So you'll see my left shoulder is quite a bit higher. My neck, what you're seeing, it's hard to kind of tell, but clearly the neck seems pretty jacked up. It's oriented to the right, so this is my right. And you'll also see my left ear is quite a bit higher, and also the base of my head on the left is quite a bit higher than the right side, and that is a typical torsion pattern. Am I still in that a little bit? Yeah, I think it's built into my cranium at this point, but it's no longer torsion because that neck can now move. The neck can rotate to the left, my head can rotate where it needs to go, and Matt will talk about that rotation of the neck later on. But what you're seeing underneath, and I'm hoping this will be your right. At any rate, this is the neck, this is the base of the skull, this is all we're talking about. So the neck is oriented to the right. C1, the top cervical vertebrae, the atlas, moves up in this position. It's called being on your right leg. This is normal. It goes up. That's normal. It helps to turn your head to the left. So this occiput should start moving to the left when you're on your right leg in preparation for you to go back to your left. That's normal. But in the torsion situation, which can occur for so many different reasons, trauma, malocclusion, dental malocclusion, open bites, cross bites, a lot of things, crowding. It can be visually driven, trauma driven, neck injuries, traumatic head injuries. It can be for a lot of reasons, or you're just stuck in a pattern for way too long and just things start to go wrong. So this torsion, so what happens is C1 is moving up, helping to turn the head to the left under normal circumstances. But in the torsion, the base of the skull on the right moves down on the atlas, so they're compressing onto each other. So when C1 is pushing up and the atlas is pushing down, that is the torsion because the head is also starting to turn back to the right side rather than standing to the left. And in that position, it throws off the placement of your temporal bones where your ear goes through, temporal bone, TMJ, so your jaw, temporal mandibular joint. So this type of position can throw off the jaw because the temporal bones are misaligned. And then it can also throw off the position of your sphenoid bone, which the eyes are kind of sitting in front of. And that can produce all sorts of different issues. So that's what the torsion position is, what I just showed you. And that's what you're seeing in the picture. And now my newer cranium is a more neutral cranium. There's not one technique that changed that. That was a sensory issue. That was vision, that was dental, and that was feet. All right, that was all sensory. There was no technique that was going to change that situation until my sensory inputs were correct. And then you see a head that starts to even out as the body started to even out. So there's no way to, again, like I said, there's no way to know you're a torsion. Don't suspect that you necessarily are. Not that, I mean, obviously plenty of people are, but don't expect that you are. And anyway, you're only going to know through PRI testing, so you got to find someone to help.
Mm-hmm.
Yeah. And so what I saw in the pictures was the jaw.
Yep.
It looked like it was shifted to the right.
Mm-hmm.
And the symptoms that you were experiencing and your long history of symptoms. And so right there, that was the cue for me that I'm pretty sure, we'll give it a try, but I was pretty sure that we were going to have to go the route of seeing someone in person. So I remember we definitely had a couple sessions in which I'm trying to figure out what you're feeling and whether you were grounded or not, because someone who's grounded is going to feel the muscles properly.
Mm-hmm.
If they're not feeling things properly, they are ungrounded. And usually, if it's not just a breathing issue, like they can't expand the rib cage, it's usually coming from up here if they really struggle to feel those muscles. And so we determined kind of quickly that you were going to have to see someone in person. So you
Yeah.
then found someone in Atlanta, and we're not naming any names right now because no one gave us permission to use names. So we're just speaking in generalizations. Matt went to see a PRI certified physical therapist in the Atlanta area, and she tested you, and you worked with her for a little bit. So can you just tell what happened with her?
Yeah, she was great. I probably did about, I think I did 3 sessions with her. Having someone be able to work on me in person was a big deal. She was just able, I think, to see differently because we were in person.
Yeah.
I basically wound up hitting a wall really, really quickly. So I think because she was able to better see what was going on with me and work more directly with me, my body responded faster to the exercises, but I wound up basically topping out. Like I hit a ceiling.
Yeah.
And I knew that I had hit the ceiling when I guess I had been working with her for, I think I was close to my 3rd session. I was only seeing her once a month.
Because you live like 500 miles away from her, right?
Yeah, well, I live 200 miles. I live 200 miles from her. So I would go down once a month. And I woke up after the 2nd session. I woke up maybe 3 weeks later one morning, and I basically felt like someone had steamrolled my face in the middle of the night. Like I just had the worst night of clenching that I've ever had. And I had to sit down in a chair before I did anything. I had to sit down for about an hour when I got up. I couldn't move. I couldn't think about anything. And then I started to realize that I had felt that way years ago when I was in college, and at certain points in my life when I had been really, really stressed. And I started to realize that I had never, my dentist, I have good teeth. I don't grind my teeth. I clench my teeth. So my dentist had never told me, oh, you grind your teeth, because you can see when someone grinds their teeth. Yeah. It's harder to see when someone clenches. And so I started to kind of piece together that there was something wrong in here. Something was wrong. Right. And my PRI PT had initially said, if we do need to do dental work, I have someone to recommend. And
did she identify you as a torsion?
I can't remember, to be honest. I don't remember.
Or that there was a neck influence?
Yeah. And I had always known that there was a neck influence. I had a patchless, I have a patchless eustachian tube. So I had been using my neck muscles to close the tube for years, and I just had constant tension in my neck.
I'm not even familiar what that is.
A patchless eustachian tube is an ear, nose, throat condition. It's pretty rare. I don't have an official diagnosis. I tried to get one, but my local hospital ENT specialist wouldn't work with my insurance. I consulted with an ENT over the phone who was an acquaintance. He asked me all the questions for the diagnosis, and he basically said, you probably have this. A patchless eustachian tube is where, so normally the eustachian tube, which is, as far as I'm aware, the tube that connects your ear canal to your sinus cavity, that tube is regulated by an opening that has a membrane. And that opening is, that membrane is opened and closed to regulate pressure. So it happens very, very quickly. When you go up a mountain, it adjusts. So in someone with a patulous tube, the membrane stays open, and not like, and it's far worse than what you would feel when you're going up a mountain. It's to the point where there's air travel and sound travel from the mouth into the inner ear, so I actually hear my voice through my head. So the patchless tube, you develop these funny tics where you're just like doing this and turning and using suction in the head, like sucking in through the nose to try and
To
make the
regulate tension.
to try and close the
Try to compress.
membrane. Yeah, so I'm trying to close the membrane and close the opening, and I probably had to live with an open tube for anywhere from 40 to 70% of my day, and I've lived that way for 20 years. And so these muscles,
SCM,
is what I use to do it.
Yeah.
So I knew that I had a neck problem.
So there's a possibility that Matt was using his neck to help regulate pressure that wasn't being regulated because of that issue with his ear.
As I've talked to the people that I'm now working with, it seems to be that, so I know that my pelvic floor is involved. I don't really completely understand it. I know that the head and the pelvis are connected, but at some point I lost the ability to, what's the word? To basically raise my pelvic floor. Like, I don't use it well.
Yeah, that has to stay pressurized also.
Yeah.
Just remember that head and ground concept. You have to be able to compress or pressurize and depressurize alternatingly. But if one part of your body simply cannot pressurize or depressurize, it throws off the pressurization and depressor of the rest. So you can be a pelvic floor patient, but my guess is most people with cranial issues are pelvic floor patients, because you can't pressurize, you can't ground. If you can't ground, you can't pressurize the diaphragm.
Yeah, well, and I didn't experience true grounding until I began the mouth work for the torsion. I didn't know what it was.
Right.
And then all of a sudden I was standing like for the first time in my life. Like, my whole body I could feel all of my muscles engage from chest all the way down through my core. My TA was fully engaged. My legs were level. I was standing. It was like, oh, I've never stood in my life. This is crazy.
Right.
Yeah. So
the PRI therapist you were working in Atlanta said, all right, I think you're going to need to go the dental route. Is that, and so she referred you to these other two individuals?
Yeah, she said to me, if you think this is a problem, then I'm going to refer you out. So she referred me out, and I did a consultation, and I partially because of the distance, I just in my pain journey, I had never calculated in my brain that something needed to happen in here. Never thought of it.
Oh, who would think of that?
Why?
I didn't know I couldn't see.
Right. Yeah.
Because I did see, but I didn't realize how much tension I had to create and able to see for how many years, until I was 40 when I got my first pair of glasses. I had no clue that I couldn't see properly until they put contact lenses in my eyes. I was like, oh my God.
Yeah.
This is easy. Like, and all the tension just started to drain out of my body. It was insane.
Yep. So because of the distance, and because I was just like shocked that this might be the solution, I actually reached out to PRI, the Institute, and I said, hey, I would really like to see if my own local dentist can make me an acrylic splint, just to see if this is, like the thing. And so they said, yeah, no problem. So they sent me the documents. And I went to my dentist. I said, hey, I'm doing this PT modality, and I want to see, I just want to try this and see what happens if it helps my body and my pain management. He said, okay. So they, took scans, sent it off to a lab, made a mandibular splint in the style of PRI. And
so it goes over the bottom teeth, right?
yeah, bottom teeth, flat surface.
Molded to the bottom, but the top of it is flat.
Yeah.
And people I know will probably ask, I made another video about it with a client of mine who had to get one. But the reason it's flat is so that the jaw can move, so it doesn't get locked up. Because torsions, anyone with cranial pattern is going to have a jaw that locks up. So their occlusion, the way their teeth touch, is an issue. So you don't want those teeth locking into place the way they currently are. So it molds over the bottom teeth, and the top of it is flat, so it allows for side-to-side movement of the jaw, because the jaw has to rotate side to side as minimally as it is as you're chewing, but also as you're moving through life, just the way your torso rotates and your pelvis. All right, so just for people who want to know why, it's got to stay flat so the jaw doesn't get locked in through the bite, because the bite is a big problem to begin with, and you want to take it out of the bite.
So he made me a splint, and I probably wore it for 18 hours a day. I slept with it because I wanted to see what it would do. And I noticed that when it would happen at like 10 or 11 in the morning after I'd been moving for a few hours. I walk a lot at my job. My ability to pivot was just way better. And like my movements were smaller. I was moving more efficiently. My ability to pivot was better. And it was enough of a change. I could tell that my body was holding, like I had some kind of connection that I hadn't had before. So that kind of was the thing that pushed me. And I said, okay, I'm really gonna do this, and I'm gonna go the dental route. So I began dental treatment with a dentist who practices PRI and does all of this stuff.
So the dentist works with the PRI therapist.
Yes. Yeah. And
so you already had a splint. Did you get another splint made with?
Did.
Okay.
I did.
And why was that?
And well, it was because that was the treatment plan that they gave me. And the dentist had their way of doing things.
Okay.
And the crazy thing, man, is that going to a dentist who knows what this stuff is about and understands the principles. So I laid down in a chair. They took molds for a couple of hours. Mm-hmm. And then I went back that day after lunch, and my dentist, put the device in my mouth, put contact paper in my mouth, and made me bite. And would take it out, take the device out, grind it down, put it back in, right. Bite. And then it was, turn your head this way, turn your eyes this way, turn your eyes this way, And she did this 20 minutes, 25 minutes. And I noticed after about 10 minutes of laying in the chair that I was chest breathing. I started to breathe much, much better and into my upper chest. And when she was done, she took a towel and she rolled it up and she put it, and I'm laying down. So she rolled it up and put it underneath my head, like back here. Yeah. And she just started doing this with the towel and moving my head back and forth. Mm-hmm. And then she took the towel and went in one direction, and then she just kept going, and I just, my head kept going, and I started grinning like an idiot because I was like, and she was laughing at me, but I was like, what is happening? My head has never moved like this, because if I had to move my head that much, I would have.
You would rotate your whole body.
Yeah, it's my whole body.
So that's a
My
huge
head.
thing. Just as I want to, for people watching, when someone cannot rotate their neck effectively, they have to rotate their whole torso. And to do that, they're going to overuse their SCMs, particularly the right SCM. And it can happen bilaterally. For a lot of cranial people, torsions, they're using both SCMs for rotation of their torso and their head. So everything becomes one segment, and you can no longer separate these movements. And eventually your vision will get tied to this movement also. And that's something that also, I'm not going to get to that point yet, but that's a really important point. It's the inability to rotate a neck because you can no longer ground on both sides, and now you can't side bend your neck, and side bending and rotation have to occur as a couple. And so we get very restricted. The natural pattern is left shoulder high because you're on your right leg, right shoulder goes down, left shoulder comes up. This is the typical pattern. And in this position, you're oriented to the right. You have to turn your head left to stay straight. And now when you try to rotate left, it can't do it. It's kind of weird, but the reasoning behind it, but it's about how the vertebrae stack. But you'll end up limited in rotating your head to the left. And the SCM becomes really overused, and it just becomes problematic. So once the neck is overactive, then you start to use it for torso rotation also. And it's just the neck, the neck, the neck, the neck, the neck. It all comes back to the neck.
Yeah. And so that was me, and I was stuck. And then in a matter of literally 20 minutes, I was unstuck. It was gone. And so she said, stand up. And I was like, I don't know if I can stand up right now. I stood up. I stood on my feet for about a minute, and then I felt my core engage, my TA. And then I started walking, and it was like, I've never walked in my life. Like and the craziest thing was I had up to that point, I had pretty good, some decent moments of like, oh, my low back just released. I remember a moment at work one day when I was walking, and I just kind of felt my pelvis just have more freedom. It's like, that feels really good. I had never gotten this to let go, and I had never had right arm swing ever. It never happened.
Yeah.
And so I'm literally walking in a 15-foot hallway, 20-foot hallway, and I'm just going backwards and forwards. And I'm like, my whole body is just like doing this. My arm is swinging, and I'm just like, I can't believe this. I had thought for years, oh, this is what it would feel like to be out of pain. And then I was and I never thought I'd get it. And then it was there. It was like, and it happened in 20 minutes. Yeah. Like, all I did was bite down on an acrylic splint that had been adjusted properly for 20 minutes.
And that's the thing. They knew what they were doing.
Yeah. They know what they're doing.
Experience in this. That's why theoretically, for a non-complicated case, you can go to any dentist, they can make the splint, and usually it'll actually be good enough. But some people are a little bit more complicated, and you really need someone who has experience doing this and who can do it legally. And it ain't me, because I'm not a physical therapist. And even though I understand everything you're talking about, I know why they were doing it, I'm pretty sure. I understand the process because I've been through it. Legally, I can't do it because I'm not a physical therapist anyway. So I can't coordinate care. I can't walk you into that dentist's office and do this stuff with you. So I am not the one. This is why what you need to do, if you have questions and you think you need help like this, is you you go to Postural Restoration Institute website, and you find someone, a PRC, Postural Restoration Certified Physical Therapist. And it says it on my site also, because I'm not working with anyone right now. I'm taking a break from all this online work for my own sanity and to rest my eyes. You go to that website and you do some research and you find someone who can help you. But that's, you were a complicated case.
Mm-hmm.
You needed
Yeah.
someone who really knew this science, who really understood what they were doing, because the fact that she had you moving your eyes as she was moving you back and forth indicates a way higher understanding of how this cranium moves and the influence of the eye muscles on jaw positions.
Yep.
When I got my first pair of glasses, and I was driving, no, it was just the contact lens, the trial lenses. I was driving home. Within 45 minutes of leaving that office, I felt my jaws decompressing. The eye musculature intimately, because of the bones behind the eyes, intimately connect with the mandible via the temporal bones and the maxilla, the upper part. So the eyes have a huge role on positioning these bones correctly. And when you move your eyes to one side, your body should go the other side. But so it's going to shift bones as you move your eyes. And if eyes get patterned into one position, that can then position your jaw in a position, and you might not it might not be calibrated perfectly. So that indicates a much higher understanding of how this whole system works than a dentist would be. I mean, they can make the thing, but they don't know how to do all what she was doing.
Well, you mentioned that you have an eye problem or a vision problem, and she identified doing her tests on me the first time I saw her, she identified that I also have one.
This is the dentist.
Yeah, this is the dentist.
Okay,
so
let me also add that I know who this dentist is, and I actually sat next to her at a PRI seminar. And the person that she works with is about as high in PRI, or was as high in PRI as you could go. So she knows, I mean, she's basically a PRI person. She's taken the seminar, so she knows all this other stuff. I'm sure she's taken the vision seminar, and she works with this very high level person. So these are all things that she can see and do without even having to be an optometrist. She can just tell.
Yeah, and I don't know what my problem is, but the way that she tested me, it was basically a tracking problem. So my left and right eyes would track differently, as a finger was moved. And
it's probably a convergence, how your eyes converge.
Yeah.
But that, again, that could be a patterned issue.
Well, and when she put the splint in, it was gone. Like
that's the insane, people do, and I wouldn't believe it either. But people who have an occlusal issue that you're treating through a dentist could then have their vision change.
Mm-hmm. Oh, my vision has changed. Yeah.
Your vision will, the moment you ground yourself for the first time, your vision may change, because now you no longer need to overuse your visual system to help stabilize you, because you felt the ground.
Yeah.
Okay.
Well,
all of these things are interrelated. That's why I did everything like individually. Like, I was on a learning process of my own. So the first thing I got was the splint, which helped. And then I got glasses, and then I got the orthotics, and then I had to get special glasses. So every time I was tinkering with the system, I was uncovering another layer of compensation. And now I'm addressing my hearing loss in my left ear. And I'm investing in very expensive hearing aids.
Yeah.
Because I notice a difference in the ring in my ears when I'm wearing these earbuds. And I'm going to have more about this in the future. That my perception of the tinnitus in my ears is much lower when I have specialized hearing things in my ear. And there was another one, and that humming sound that was devastating me over the last 4 or 5 months and was preventing me from doing any of this stuff online is also much better managed at this point. So there's so many things that can be involved in a torsion, but they have to be addressed by someone competent.
Yeah.
And it has to take into account vision, feet, and dental at the same time. Yeah. because the moment you tinker with one system, it could affect the other system.
Yep.
And it's annoying as hell because you might have to keep going back and forth getting things adjusted, but you're essentially adjusting your sensory system.